Hello, very good afternoon to all my dear viewers. I'm Dr. Syed Mustafa Ashraf. I'm consultant physician, Department of General Medicine at Prathima Hospital, Kachiguda. Today, I'll be talking to you about the current trend which is going on in the city, and as we are facing a very extremes in the climate, as it is supposed to be a summer season peaking around, we have been seeing temperatures of 40, 42, but due to the climatic changes, we are seeing rains as well in this season. So due to this, strange climatic conditions, there are many other uh, health effects also on the individuals are commonly seen. Today, I'm going to talk about seasonal water and foodborne infections. So, as you can see, due to the change in the water and increased bacterial count due to the climatic variation, as well as foodborne infections, as the food doesn't remain that fresh in summer season as compared to the other seasons. So due to the temperature variability, there is also contamination in the food as well. So there are two aspects, that is, one is food related and second is water related. As recently you might have read in newspapers as well, okay, there have been many places where water samples were found to be contaminated, and that too of which of high bacterial count, and patients which I am receiving and I am treating, are having strange type of viral illness, that is starting with high grade fever with generalized body pains. Patient is having lot of body pains, and there is no cold or no loose motions as such. Patient is having only high grade fever and body pains, and patient is not able to clearly explain whether he has eaten the food outside, is it due to outside, or waterborne, which the water he or she is drinking at home. So first of all, I'll cover foodborne infections. So what is foodborne infections? Foodborne infections are those infections which are usually caused by, consuming contaminated food, be it a vegetarian food or a non-vegetarian food, or be it a very mild kind of a, vegetable or a fruit salad as well. If suppose if it gets contaminated with a bacterial or a viral or a parasitic infection, so unless and until we become aware of all these things, we cannot, presume that how did we get this infection. So basic aspects is, first is to avoid outside food. Usually this season, usually the period of holidays where, students after completing their exams tend to go outside, visit outside places. Don't say that you know totally avoid it, eating outside, but make sure the food quality and the hygiene is maintained properly. Make sure the food is properly cooked, it is hygienic, and the place and the cooking environment around is good, and the food which is served is properly served. So due to the climatic variation, what happens is the food gets contaminated very easily, and so there forms the bacterial colonization or a viral, increase in the viral count or a parasitic infection. So when the person consumes that, initially patient is likely to have severe pain abdomen, vomiting, loose motions, and uh, loose motions with that, and severe cramping pain in the stomach. This needs to be understood. This happens usually within 24 hours, and later if it gets prolonged, it might, cause severe dehydration, which might lead to hospitalization. So early thing is to replace proper, water content. As you can see commercially available ORS formulation, which is WHO approved, that you can give it as the amount of fluid which is lost, you can replace with that either with normal water or ORS. Or if the patient is vomiting continuously, you should seek a doctor's help immediately so that the infection gets cleared as well. Sometimes if it is not a bacterial infection, it might be a viral infection as well. The difference between viral infection is it will not respond to antibiotics prescribed. So the patient will continue to have these symptoms for 4 to 5 days and patient's health doesn't seem to improve. So at that time, either the patient gets confused, is the treatment wrong, or is it resistant, or the antibiotic is not working for him. No, it is not this condition. This happens in two aspects. The first aspect is food poisoning. Please understand a bacterial infection, stomach gastroenteritis and food poisoning. Food poisoning is happens when the bacteria releases the toxin. There is a bacteria called E. coli which releases a form of toxin in the food, and after which the patient tends to have continuous loose stools and pain abdomen and vomiting despite giving adequate medicines as well. So that time patient needs to take proper medication, make sure the physician who is treating understands the problem and simultaneously treats it. And similarly to the viral infection as well, it helps when properly administration of IV fluids and dehydration is covered. So with this, easily these symptoms can be treated well. And what about the preventive aspect? Preventive aspect, as you see, you all families might be keeping your surroundings clean, and the food which you bring for cooking, be it vegetables, non-veg, or whatever it is, make sure it is cleaned properly, and make sure to spend some time in cleaning the food properly or the vegetables properly which you bring from outside. And after once they are properly cleaned up, make sure it goes for a thorough cooking, that is it is fully cooked, not it is partially cooked or partially left like that. So these are all the aspects. And third thing is parasitic, that is what we call it as sometimes amoebiasis, that is uh, it results in dysentery, that is cramping, pain, abdomen and bloody loose stools. There is blood in loose stools as well, and these infections happen due to some parasitic infections. So we need to take care of that as well. So usually the most commonest would be bacterial and viral, which are rampant in our city and due to the present situation and this season. This was regarding the bacterial aspect and foodborne aspect. What about the waterborne aspect? As water is a universal solvent and it is freely available everywhere, but water is good when it is in its perfect hygiene, in its perfect form, not polluted. So this water will give you more health rather than uh, you know consuming a polluted water or a contaminated water. Usually it happens when you store water, you know many of you might store for water in that pots, and apart from that the water which is usually stored in hotel, served in hotels and all, is it not properly taken care by the cleaning methods, the adequate filters which they are using? Is it helping or not? So these are all the two aspects which are more important, and water carries more bacteria and parasites and even viral infections, and gets very easily contaminated and gets more prone to infections. And there are cases with drinking contaminated water due to either of the reason, or due to poor sanitary conditions, or the water which you received from your drinking water tap, and the place, the area which the water is stored and filled up at your place, the tanks are clean. Make sure the tanks are clean, make sure your filters are working properly, and please make best use of your water by drinking it in its clean and pure state, so that your hygiene gets better and you stay in a proper healthy season. The steps you need to take to prevent these kinds of disease is carry water with yourself wherever you go, either the packed bottled water or the water which you carry from your house, which is supposed to be clean. Secondly, make sure the food which you are taking, first observe what is being cooked, how it is being cooked, and areas where surrounding zones are not polluted. You might see stagnant water, you might see some trash corner around, and flies around, many of flies around you, and food stinking, or these are the kind of a warning signs which initially you should be aware of to see, no, this is not the place you should be eating. Either you go to a proper place where they keep their give their customers disposable plates and disposable spoons as well, which to a much extent reduce the contamination, and the food which is served immediately, which is properly immediately cooked and served, not stored and served, because the food regulatory authorities are very stringent on these, but due to some unknown reasons, other outside places continue to serve contaminated and stored food, which is not good for the health of the individual. Similarly, the food which you store at your home, make sure the vegetables and the meat particularly, there should be proper conditions maintained to store them. And do not cook, do not eat stored food which for a longer time, the food which is stored for a longer time. Please do not consume, discard it, or give it to someone. Or it has been more than 12 to 24 hours delay. Please give it to the needy. Please make sure you have a portion of the food, one for the needy, at least for an individual to eat. This will definitely cut down the rate of infection, and you will feel and you will be privileged to serve one of the persons of the community who is not having anything to eat. So he can also eat a healthy hygienic food, and you can also stay happy with your children and the elderly and yourself at your home. With this, I take leave, and if any questions are there, I am open for the questions. So one question is, which bacteria causes food waterborne disease? See, the most commonest bacteria is E. coli, that is Escherichia coli. It is the gram-negative bacteria, usually found in contaminated places, because it is a very commoner bacteria seen in the community. So this is the most commonest infection. Almost in 80 to 90% of bacterial infections, this is the most commonest bacteria which is found. Another question is, we use freeze excess water and take it over 2 to 3. Is it see, drinking extremely cold water is not good for your health. Please remember this. And frozen water and those kinds of stuff, storing it for 2 to 3 days, usually does not spoil the nature of the water, but the drinking cold water will spoil your health. So please avoid that, and it will definitely have health problems. You might be hearing of the term called fatty liver and all and all. People usually eat food, then they have the habit of drinking cold water with food. This is the important reason that slows down your metabolism. If you are eating fat rich food, which is rich in fat and oil and heavy food, heavy calorie food. So the foods which usually slows down your metabolism, particularly in the night, will cause all these problems. So please avoid drinking immediately cold. Yeah, mildly cold water is definitely permissible, and room temperature water is definitely permissible. One question: do we need to take boiled water, or water cans are enough? See, if you have a facility of getting those already processed water, like other companies sell regular one, that is fine. Or if you are drinking directly from water, collecting water and storing and drinking them, better you boil it and store the water, and that water should not be there for more than 48 hours. It should be discarded. What are the tests to identify whether bacterial infection has it? The commonest bacterial test to is a stool examination test. Send the stool examination test for cultures and total examination. This will show you any bacteria is there. Another question: eating ripened foods is good or bad? See, uh, foods which are totally ripe, are ready to be eaten and not to be stored, because they have the chance of immediately getting stale or getting spoiled easily and very easily. The moment you cut, if for example a mango which is totally ripened, you cut it in the morning and just keep it outside, and till evening it is totally dried up and it starts to smell. So it is good to eat ripened fruits because it is fully rich in all nutrients, vitamins and all the antioxidants, and you can eat it at the same time when you cut it. Another question is, can we drink in plastic water bottles, and can we buy and drink some company water bottles which are made up of plastic material? Do we get any problems? And if we drink or take food in plastic box, see the grade of the bottled water bottles which are branded in the market are supposed to be consumed within one day itself. Rather, storing them for more than 24 hours and drinking is not at all good, particularly in a plastic bottle. That has its own disadvantages, because any medium, especially that's why, if you can remember in previous days, probably if you are in your 40s or 50s, you will remember in your childhood they used to keep water in steel, copper jugs and utensils, those or glass ones, so that keeps the water intact and doesn't let the water get into chemical reactions with the plastic. Anyways, plastic is not good anytime, but for carrying purposes you can carry for the same day and immediately take another bottle if you are going for the next day. I used to take hot water all the day. Is it good, and should I take cool water some? See, there is a wrong concept. People drinking hot water in the morning or continue to drink hot water. Usually, hot water is never advised except for if you are taking a decoction of tea, not beyond that. Hot water is not good for your health. It usually changes your body temperature, and there are a lot of problems. People might develop gastritis also with that, a lot of acidity. So please avoid taking hot water as your drinking water. No, you can take cold water. You can take not that chilled water, yes, but cold water is absolutely permissible. You can drink it. What foods to avoid during the situations in the rainy season? See, rainy seasons particularly, in rainy seasons that there is a trend of eating Chinese, or the typically the pani puris, the the chatpata foods and all. Those are all the foods which definitely are more prone to getting contaminated. And the second thing is any spicy any spicy food which is cooked and properly uncooked, it is not properly cooked, that will definitely give uh, high chance of infection. Are there any airborne infections due to this sudden climate changes? Yes, there are. Yes, there are, absolutely. It's a good question. There are airborne infections as well, but the season, totally comes to the peak during the rainy season. not abruptly in the summer season. However, I would like to bring to the notice of the audience that COVID infections, the numbers, the report of positive numbers are appearing in the news, and definitely it's an airborne infection, and we need to be careful. And common flu was very rampant and common last month, which we saw many infections at that time. One more question is, please suggest drinking bore water is good or RO water is good. See, drinking borewell water has its own side effects. The impurities in the hard water, what we call it as the borewell water, are there, and definitely the RO water or the soft water, what we call it as, has definitely good advantages for the health. My mother avoid taking mangoes due to sudden rains these days and saying bacteria will grow inside. Is it true? See, as I said, the whole ripe food, if you eat it incompletely and leave, then there are high chances of bacterial infection. Yes, she is right. But this is the reason. If you are eating the whole fruit at a one time, then there is a no risk or no problem with the infection. But if you leave it and keep it like that, it will definitely go stale. Meat consumption is good nowadays. See, meat consumption, the problem with the meat consumption is the proper storage. First thing. Second thing is properly cooked. It is totally cooked or not. If improperly cooked, yes, definitely it will cause infection, and improperly stored, it is very dangerous. Is there any necessity to wear mask? See, I always say that if you are strong enough and you have a strong immunity, and despite all these measures, if you are going into a crowded place, you need to wear mask. Particularly, see, in last 20 years, there was never a necessity to wear mask till the COVID era as well, and before the COVID also, people didn't had the need to wear a mask, at least even during the times when swine flu was prevalent, that time also. And the time now the time is, there is a lot of air pollution, and the air quality which is around our zone is not good. And so if you go out, and make sure, if you are going into a very crowded place, make sure you wear a mask. It's nothing but just wearing a mask doesn't harm you anyway. Can food in a plastic box, is it harmful? See, the food grade plastic box for your food eating is not harmful. Please remember this. It will not disintegrate or mix with your food. You can use it, but it has its own life. Some good quality plastic grade tiffin boxes have a life of 1 year, or some may have 2 years, but better is you can discard it after 1 year. Yeah, with the advent of we are suffering from severe mosquitoes due to climate. Tried all the ways, but no use. Please suggest what are the best. See, because the rains have come, there is definitely an increase in mosquito population. So, in order to provide it, it's better to use mosquito repellents that is commonly available in the market. There are many mosquito repellents and creams available. So, in order to prevent them, you might have tried sprays. See, these sprays are only to paralyze the mosquitoes, not to kill them. The best way is to use, nowadays you are getting medical coated, the medical coated medicine coated nets, for you, so that you can use nets. So with that the mosquito will get repelled and not come to you. And if you are sitting outside for long hours and anywhere, you can carry a repellent or a liquid and you can apply it to the skin. That is an absolutely preventive measure. And if you at our home and still mosquitoes are coming, you can use opt for door nets or window nets. That will be helpful. And as evening sets in, before evening sets in, please shut down all your windows and the doors, so that the entry is particularly stopped. Can we risk children having pani puri? My children love, but I am ignoring it. See, ignoring is good, but if children are insisting, it is no problem. If you find a good hygienic place where majority of people go, and there is a proper hygiene, they abide by the whole the environment. What you see is good and hygienic. There are no flies. There is no dumping of garbage around, and the kitchen is proper. Make sure, because it's a common thing. यहाँ का this this food is good. This area's food is good. So go by that. What are the major problems will get intake of chlorine? See, chlorine water, if chlorine content in the water increases, there are, signs of, drinking hyperchlorinated water will cause a bit of dehydration in your body, skin irritation, eye irritation, and hair loss as well. But our municipal authorities make sure that the chlorinated water is properly mixed and it is checked. There are very rare chances that chlorinated water, if used in a permissible uh, measures, will not cause any health hazard. The problem, the main use of using chlorinated water is to avoid all these infections in the society. What food restrictions to take by chronic health problems like diabetes, CKD? See, all these patients have their own food limitations. For example, diabetes cannot take sweets or juices or any carbohydrate rich diets. So they need to avoid by that. And patients with CKD, these are all the patients. They have to restrict water content. They have to restrict the salt content. They have to be on strict renal diet. These are all the things they need to take precautions. Using bleach in shower can reduce the risk of waterborne. Yes, definitely. Bleaching powder also helps in preventing. But pool contamination, swimming pool contamination is one thing, that there might be some small children around swimming also. Sometimes they also urinate in the pool without knowing, and some adults also urinate. So what they are carrying are what infection, because there are many infections like chlamydia, people carry, and that can cause infertility as well in males and females as well. So the pool also should be properly taken care of, and make sure you are properly guided. You guide children properly not to urinate in urine while swimming, and make sure that you clean up before taking a shower in the pool. Can we use Dettol in water usage for all home? See, not that extreme. It is not necessary, to use Dettol in water for your bathing purposes or cleaning purposes. However, it was required in COVID pandemic. Of course, it was very much the need. But now you can use, but the content is, for one bucket of water you need to dilute one small bottle of Dettol. That is the exact required amount of quantity. So that will help you. So I think all the questions are over, and I hope all my viewers have understood my message about keeping yourself healthy in this season, and hopefully in coming rainy season you also will definitely take care of yourself and take care of your health, and your body will take care of you. It is a mutual reciprocation of how you take care of your body and how the body will take care of you. So it's definitely a basic individual responsibility of attending to your body responses. For suppose pain is indication of something is going wrong, any kind of problem, you need to attend it. And if you attend it, you have a healthy body and a healthy mind. and with that you can do all of your works in a very good way, in a very pleasant way, and make your life a very peaceful one. Thank you, dear all.